में बात करने वाले हैं टाइप्स ऑफ थेरेपी यूज इन कैंसर ट्रीटमेंट फॉर द कैंसर पेशेंट.
जी ना है अल्हम्दुलिल्लाह सब तो है शुक्र बिल्कुल बिल्कुल अल्लाह आसान करेगा जरूर ना हमको भी तुम्हारे लिए भी हमारे बच्चों के लिए भी है अल्हम्दुलिल्लाह है अल्लाह का शुक्र है अच्छा ही है हाँ वही है बेहतर नहीं है हाँ, अच्छा। जी जी अच्छा हाँ हाँ जी 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 अच्छा
Today's video topic is radiation therapy. Radiation therapy is a form of cancer treatment that uses high energy particles or waves, such as X-rays, gamma rays, and protons, to
अच्छा
kill
हाँ
cancer cells
ठीक
and
है
shrink
सर
tumors.
जी जी बिल्कुल
It is most commonly used to treat cancers of the brain, breast, lung,
16-17
pancreas,
सौ
and
रुपये एक
prostate.
सेशन था
Radiation therapy is also used to treat non-cancerous conditions, such as uterine fibroids and pituitary tumors. Radiation therapy can be used as a single treatment or in combination with other treatments such as surgery, chemotherapy, or immunotherapy. Types of radiation therapy. There are three main types of radiation therapy: external beam radiation therapy, or EBRT, brachytherapy, and stereotactic radiation therapy, or SRT. External beam radiation therapy is a type of radiation therapy that is administered from outside of the body using a high energy beam of radiation. It is typically used to treat brain, breast, lung, and prostate cancer. Brachytherapy is a type of radiation therapy that is administered from inside the body. It is typically used to treat cervical, endometrial, prostate, and skin
हेलो हाँ
cancer.
मिल
Stereotactic radiation therapy is a type of radiation therapy that is
हाँ ठीक
administered
है
from outside the body, using a specialized machine to deliver a highly focused,
क्या कह
single
रहे
dose
साहब
of radiation. It is typically used to treat brain tumors, certain types of breast clinic. During the first visit, the radiation therapist will take a medical history, review the patient's cancer diagnosis, and discuss the treatment plan. The patient will also have imaging tests, such as CT or MRI scans, to help create a treatment plan. During the treatment session, the radiation therapist will position the patient in the treatment machine and administer the radiation dose. The treatment session typically lasts 15 to 30 minutes. The patient may be asked to remain still during the treatment session in order to ensure accuracy and safety. Cushions and restraints may be used to ensure the patient remains in the correct position. During the treatment, the patient will not feel pain, but the machine may make a loud buzzing sound. Benefits of radiation therapy. Radiation therapy is a safe and effective way to treat cancer. It has been proven to be effective in killing cancer cells and preventing them from growing and dividing. It also helps reduce the inflammation around the cancer area. Side effects of radiation therapy. The most common side effects of radiation therapy are fatigue, skin changes, and hair loss. Patients may also experience nausea, vomiting, and diarrhea. Long-term side effects can include infertility, growth of new cancer cells, and organ damage. The patient may also experience site-specific side effects, which are side effects that occur depending on where you receive the radiation. For example, radiation therapy directed to the brain may cause side effects such as hair loss, headaches, brain fog, and seizures. Today's video topic is radiation therapy. Radiation therapy is but the machine may make a loud buzzing sound. Benefits of radiation therapy. Radiation therapy is a safe and effective way to treat cancer. It has been proven to be effective in killing cancer cells and preventing them from growing and dividing. It also helps reduce the inflammation around the cancer area. Side effects of radiation therapy. The most common side effects of radiation therapy are fatigue, skin changes, and hair loss. Patients may also experience nausea, vomiting, and diarrhea. Long-term side effects can include infertility, growth of new cancer cells, and organ damage. The patient may also experience site-specific side effects, which are side effects that occur depending on where you receive the radiation. For example, radiation therapy directed to the brain may cause side effects such as hair loss, headaches, brain fog, and seizures. Radiation directed to the abdomen may cause cramps, nausea, and vomiting. So it is important for patients to discuss the potential side effects of radiation therapy with their doctor before starting treatment. At the end, radiation therapy is an important part of many cancer treatments, and it is important to talk to your doctor about the risks and benefits of radiation therapy.
Our video. Please do not forget to like and share the video. Also,
machine is called a linear accelerator. It uses electricity to create. This radiation therapy treatment machine is called a linear accelerator. It uses electricity to create powerful X-rays. During treatment, you'll lie down on the treatment couch. The couch can be moved in several directions to help get you into the right location. We will use a system of lights, lasers, and computer readouts to help with that, so the room is usually semi-dark. The machine can also move around you, but it will not touch you. The X-rays come out of the machine here. The beam of X-rays will be shaped precisely to suit your needs. The direction and shaping of the X-ray beams is different for every patient. They are planned out by your radiation oncology team using a 3D computer model of you made out of your planning CT scan. This scan and other information is used by your doctor to determine where they want the radiation to go. They also highlight normal organs that need to be avoided. In this case, the doctor has marked an area that is close to the kidneys and spinal cord. Several beams have been used to give a high dose of X-rays to the target, shown in red, while other parts of the body get a lower dose or are avoided. Your plan has been created with the same sort of precision, which is why the treating radiation therapists will take great care in positioning you the same way you were when you had your planning CT scan. Your radiation therapists will use lights, lasers, and reference marks to help position you. Sometimes they'll ask you to assist with small movements, but mostly they will ask you to keep still as they adjust your position. Once the team have positioned you and gone through their checklist, they will leave the room. You will hear a beeping sound as they go. While the staff are outside the room, they can see and hear you on closed-circuit TV. A microphone also lets them speak to you during treatment. Before treatment starts, the staff may use these robotic arms to take images. These images allow the team to see bones inside your body and make sure that they are positioned in the same way they were when you had your planning CT. If necessary, fine adjustments can be made before the treatment starts. During treatment, you will not feel or see the radiation, but you will hear the machine buzzing. Each X-ray beam delivers a specific amount of dose each day. They generally last a few seconds each, but some can go for a minute or more. Your radiation therapy team will tell you how many beams your doctor has prescribed and give you an estimate of how long it will take each day. If you have any questions at any point, the team will be happy to assist you.
Video treatment. वीडियो ठीक नहीं आ रहा, वीडियो ठीक नहीं आ रहा।
चलेगा नहीं आ रहा था,
हम्म
चलेगा भाई।
Recent developments have shaped and deepened our understanding of HER2 breast cancer. In this breast cancer update, we'll cover the new category of HER2 low breast cancer and new treatment options with Dr. Jamie McKenzie, Senior Breast Medical Oncologist, TGH Cancer Institute. Welcome to MDcast by Tampa General Hospital, a go-to listening location for specialized physician-to-physician content and a valuable learning tool for world-class healthcare. I'm Amanda Wild. Dr. McKenzie, thank you for being here.
Thank you, Amanda. I'm very excited to be here to talk about some of the updates in breast cancer management in 2023. Called 3+ on immunohistochemistry or 2+ with a subsequent test that was positive called in situ hybridization. HER2 negative is the remainder of those patients. That means you're classified as HER2.
कितना ज्वाइन किया?
मैं 4 आया था, अभी 3 हो गया।
कैंसर के उपचार के सिद्धांत। इस वीडियो पॉडकास्ट में हम कैंसर के उपचार के सामान्य सिद्धांतों पर चर्चा करेंगे। इस प्रस्तुति में हम कैंसर के उपचार के विभिन्न लक्ष्यों, प्रबंधन लक्ष्यों और उपचार निर्णय लेने में मार्गदर्शन करने वाले 3 कारकों और स्थानीय बनाम प्रणालीगत कैंसर के उपचार की समीक्षा करेंगे। कैंसर के उपचार के 2 लक्ष्य होते हैं, उपचारात्मक या उपशामक। उपचारात्मक उपचारों को कट्टरपंथी भी कहा जाता है और इसमें इलाज के लिए कोई भी उपचार शामिल होता है। उपचारात्मक उपचारों के संबंध में एक उपचार प्राथमिक उपचार या उपचार सहायक हो सकता है। यह प्राथमिक उपचार के अतिरिक्त एक उपचार है। उदाहरण के लिए, एक मरीज का प्राथमिक उपचार सर्जरी हो सकता है और कीमोथेरेपी एक सहायक उपचार हो सकता है जो बाद में दिया जाता है, या एक उपचार नियोगेंट हो सकता है और प्राथमिक उपचार से पहले दिया जाता है। उदाहरण के लिए, एक मरीज को निर्णायक सर्जरी से पहले विकिरण या कीमोथेरेपी दी जा सकती है। उपशामक उपचार गैर उपचारात्मक होते हैं और आमतौर पर लक्षणों को नियंत्रित करने या जीवन की गुणवत्ता में सुधार के उद्देश्य से होते हैं। उपचार के उद्देश्य और प्रस्तावित उपचार के प्रकारों के बारे में निर्णय लेने के लिए हम 3 कारकों पर विचार करते हैं। ट्यूमर, उपचार और रोगी कारक। सबसे पहले हम ट्यूमर कारकों पर विचार करते हैं। प्रत्येक रोगी में एक अलग ट्यूमर होता है जिसके विशिष्ट गुण होते हैं जो उपचार का मार्गदर्शन करते हैं। ट्यूमर को रोग संबंधी रूप से वर्गीकृत किया जाता है और उपचार विकल्पों को निर्देशित करने के लिए लगातार चरणबद्ध किया जाता है। याद रखिए कि ट्यूमर स्थानीय या प्रणालीगत हो सकते हैं। यह उपचार के उद्देश्य का एक प्रमुख निर्धारक है। समीक्षा करने के लिए स्थानीय ट्यूमर का उपचारात्मक रूप से किया जा सकता है। कई स्थानीय ट्यूमर के लिए उपचार में सर्जरी या विकिरण शामिल होगा। जो ट्यूमर प्रणालीगत रूप से अधिक फैलते हैं, उन्हें अक्सर ऐसे उपचार की आवश्यकता होती है जो कई क्षेत्रों को संबोधित करते हैं। इनमें से कई ट्यूमर के लिए हम कीमोथेरेपी का उपयोग करते हैं। विचार करने के लिए कारकों का दूसरा समूह उपचार कारक हैं। इतने सारे उपचार विकल्पों के साथ सबसे उपयुक्त विकल्प का चयन करने में मदद करना स्वास्थ्य पेशेवर की जिम्मेदारी है। उपचार की उपलब्धता और प्रभावकारिता जैसे कारकों पर आमतौर पर विचार किया जाता है। संभावित प्रतिकूल घटनाओं को समझने और सभी उपलब्ध विकल्पों की जानकारी देने के लिए रोगियों को भी निर्णय लेने की प्रक्रिया में शामिल किया जाना चाहिए। अंत में हम रोगी कारकों पर विचार करते हैं। सभी उपचार विकल्प रोगी से संबंधित होने चाहिए। विशिष्ट उपचार का निर्णय लेते समय रोगी की सहनशीलता और उपचार से उबरने की शारीरिक क्षमता सबसे महत्वपूर्ण होती है। किसी मरीज की कार्य क्षमता का आंकलन ईस्टर्न कोऑपरेटिव ऑन्कोलॉजी ग्रुप द्वारा विकसित ग्रेडिंग स्केल से किया जा सकता है, जिसे संक्षिप्त रूप में ECOG, ECOG कहा जाता है। आप ECOG स्केल को हमारे उपचार मॉड्यूल में सामान्य ऑन्कोलॉजी सिद्धांतों के अंतर्गत देख सकते हैं। बेशक, किसी भी निर्णय लेने में मरीज की इच्छा सर्वोपरि होती है। आइए इसे एक वास्तविक उदाहरण के साथ समझते हैं। यदि मेटास्टैटिक लंग कैंसर से पीड़ित 70 वर्षीय मरीज अपने उपचार के बारे में आपसे मिल रहा है, तो उपचार निर्णय लेते समय आप निम्नलिखित कारकों पर विचार कर सकते हैं। सबसे पहले, आप उसकी ट्यूमर का मूल्यांकन करेंगे। यदि यह ट्यूमर मेटास्टैटिक लंग कैंसर है, तो यह निर्धारित होगा कि सभी उपचार प्रकृति में पैलिएटिव होंगे। उपचार कारकों के संबंध में, आप विचार करेंगे कि कीमोथेरेपी या रेडिएशन इस मरीज के लिए पैलिएटिव कैसे हो सकता है। आपको इन उपचारों की संभावित रुग्णता के साथ इनका मूल्यांकन करना होगा। अंत में, रोगी कारकों के संबंध में, आपको इस मरीज की समग्र कार्यक्षमता पर विचार करने की आवश्यकता होगी। उदाहरण के लिए, क्या वे उपचार को सहन करने के लिए पर्याप्त रूप से स्वस्थ हैं? कैंसर के उपचार के सामान्य सिद्धांतों पर हमारी चर्चा यही समाप्त होती है। अधिक जानकारी के लिए आप learnoncology.ca पर कैंसर उपचार मॉड्यूल के सामान्य सिद्धांतों और उपचार के विभिन्न तरीकों के बारे में हमारे वीडियो पॉडकास्ट का संदर्भ ले सकते हैं। धन्यवाद।
Over 30 years ago, AA set out to reimagine what paper could be for people and for the planet.
Hey there, welcome to the channel. This video will be an introduction to cancer. It's best for beginners, someone who will be taking an oncology course, if you work in the oncology department, if you have an oncology rotation coming up, or you're going for a PGY2 in oncology. This video will cover exactly what cancer is, risk factors, causes, pathophysiology, diagnosis, and management. The goal on this channel is to simplify the information for you so it's easy to understand. So if you feel like I accomplished this during the video, then please show some support by hitting the like button and also subscribe for more videos like these. Thank you. By definition, cancer is a disease characterized by uncontrolled growth of abnormal cells. Keywords here are uncontrolled growth, which doesn't necessarily refer to the cell getting bigger in size, but instead an increase in the numbers just like this without anything stopping it. This occurs because the cell is abnormal or mutated. Mutated or mutation meaning there was changes in the DNA or genes that led to an abnormal cell that doesn't function as it would in normal circumstances. All cancers start with mutations in our DNA. Just like how for diabetes we think of sugar or glucose, for cancer, let's think of DNA and genetics. DNA forms the building blocks to all mankind. So this guy here is actually made up of many cells, and these cells are all made up of chromosomes, and these chromosomes are made up of DNA, and this DNA contains our genetic information, our genes. These genes contain instructions for your body to follow and build things that are needed for the body to function properly. Now, cells divide in normal circumstances to form new cells. This mechanism helps get rid of any old or damaged cells. The body has proteins to help regulate this. First is the tumor suppressor gene, which encodes for a tumor suppressor protein, and this protein will stop cell division. It's really meant to prevent cells from dividing uncontrollably. Then you have the proto-oncogene, which encodes for a protein that promotes cell division. As I had mentioned before, cell division is needed to replace damaged cells with new cells. Mutations in any of these proteins can lead to abnormal growth of cells that form a mass, aka a tumor. If a tumor suppressor protein is mutated, an abnormal cell can divide uncontrollably with nothing there to stop it. If the proto-oncogene protein becomes mutated, it will be known as an oncogene. This can cause the cells to divide uncontrollably and possibly bypass restrictions from any tumor suppressor proteins. Cancer can occur in almost any part of the body, and we divide them into two main groups: solid tumors and blood cancers. Solid tumors can also be divided into two subcategories: carcinomas and sarcomas. The term carcinoma refers to cancers that begin in tissues or major organs. Examples include breast, lung, colon, and kidney cancer. Sarcomas occur in connective tissues such as muscles and bones. Blood cancers are divided into leukemias and lymphomas. Both of these type of cancers affect your immune cells. So there will be an increase in the number of immune cells. The difference is that leukemia begins in the bone marrow, while lymphomas normally begin in the lymph nodes. Now, whether a solid or blood cancer, there are shared risk factors that lead to the mutations of the proteins that control cell growth and cell death. Cancer is known as the disease of the old. So the older you are, the higher your risk is. The reason is because of an accumulation of mutations over the years, and cancer does not occur due to one single mutation in the cell. Next, cigarettes. That's because cigarettes have over 70 chemicals that can cause cancer. These are referred to as carcinogens. Cigarettes or tobacco smoke is a risk factor for over 18 different types of cancers. Next, being overweight is a risk factor we don't usually think of when we talk about cancer. This may be due to the long-term inflammation and an increase of several hormones in these patients. So unfortunately, certain mutated genes can be passed on from parent to child. This doesn't mean that if cancer runs in your family, you will for sure get it also. In fact, only about 5 to 10% of all cases of cancer are inherited. It's just that sometimes people in the same family get cancer because they share behaviors that raise their risk. Next, alcohol. So everyone on this planet knows that smoking increases your risk of cancer because of the awareness that has been made about this. But with alcohol, I feel like we don't usually think of cancer. Even though it's actually listed as a carcinogen by the National Toxicology Program of the U.S. Department of Health and Human Services. And lastly, UV light and radiation exposure. So if we know the risk factors, then why don't we check everyone for cancer so we can treat it before it gets really bad? Well, we do. It's known as screening, but we do not check everyone. Based on current and historical data, researchers have been able to identify people who may be at an increased risk of developing certain cancers. Screening is really based on risk factors. So for example, if studies have shown that breast cancer is more common in women that are age of 40 or higher, then that's when we want to start screening them. So we will do that with a mammogram to check for abnormal growth of cells. Another example of a screening test is a colonoscopy to check the colon for abnormal growth. And also a low-dose CT scan can be used to screen for lung masses. The term low dose in this case is referring to the amount of radiation that the patient will be exposed to, which is also another reason why we don't just screen everyone for cancer. Because although screening has its benefits, there are also some risks associated with it. The main benefit of screening for cancer is being able to detect it early. This allows us to treat it right away. Less risk of diagnosing the patient when the cancer has spread to the other parts of the body, which would then improve the overall survival as well. Some of the risk factors or cons associated with screening are false positives. When we say yes, there is a cancer, when in reality there's no cancer. This can be reduced with a test with high specificity. False negatives. When we say that there is no cancer, but there actually is. This can be reduced with a test with a high sensitivity. Screening may also lead to overdiagnosis. You see, a lot of people have benign, non-cancerous, abnormal growth of cells that will never become cancerous. But when we screen and see this, it may lead to unnecessary diagnosis followed by an intervention. And lastly, potential harm, like how some of the tests expose patients to radiation, which is also a risk factor for cancer. So screening may help find a cancer at a very early stage, especially when a patient is not experiencing any symptoms. But in the patients who do have symptoms, they will head to the hospital, and that's when the team will find the cancer. Since there are so many different types of cancers, symptoms are usually associated with the type of cancer. So lung cancer, patient will present with coughing. Colon cancer, possible GI bleed. So they are specific, but cancer patients may also present with non-specific signs and symptoms. By the way, if you think I'm doing a good job explaining this topic, please use 5 seconds to hit the like button and subscribe. And also follow me on these social media platforms for more videos. Cancer cells usually have an irregular size and shape. This study will allow them to see how these cells look and what markers they express. The type of cell is important as it helps confirm where the cancer originated from. Cancer cells usually have an irregular size and shape and a larger and darker nuclei. So this image depicts what I just discussed. You can see the cancer cells are not organized, very messy, and no borders. The molecular test provides information about any mutated genes and proteins. Depending on the cancer type, certain mutations may be present. Please remember that if this mass that was found was benign, it will look more like normal cells under the microscope and will not express certain mutations. Once the cancer is confirmed, the patient is staged. Solid tumors are generally staged from 1 to 4, with 4 also being known as metastatic. At this point, the cancer has moved from point A to a distant location, point B. We usually use the TNM staging. As the stage number increases, the value of the TNM staging also increases. So T referring to the tumor size becomes bigger, and which is the nodal involvement, there's more lymph nodes with cancer inside, and M, whether or not the cancer has metastasized. We want to catch the cancer early, not in stage 4. In early stage cancer, we have more treatment options, and also these patients have improved survival. So management varies from stage to stage, but let's learn about the general management of these patients. Patients may receive surgery and or radiation and or medications. And I use the term medications instead of chemotherapy because a lot of patients are now on more targeted therapies. We will discuss this later. Most patients with solid tumors will receive some form of surgery, especially when the cancer is not too big in size and it hasn't spread. So anywhere from stages 1 to 3 usually. This is when the surgeon will go in and just remove the mass. In stage 4 cancer, the tumor has spread to distant organs, so it's impossible to remove all the cancer. Keep in mind that as it metastasized from point A to point B, there may be cancer cells that fall off, which may then start growing in numbers as well. Therefore, surgery is not recommended, and the goal is palliative care. Surgery can happen before or after radiation, plus or minus medications. You'll hear the term adjuvant and neoadjuvant a lot. When you hear this, it's usually referring to the medications that a patient will receive in reference to the surgery. In patients whose tumors are too big to go right into surgery, we usually give them chemo first to shrink the tumor, and then they will proceed to surgery. In this case, the chemo or medication given is known as neoadjuvant therapy. If the medications are given after surgery, it's referred to as adjuvant therapy. Surgery improves overall survival, and patients have even better outcomes when it's combined with other treatment modalities, like radiation, also known as radiotherapy. Even though long-term it may be a risk factor for cancer, it's also very effective in managing our patient in the immediate term. Radiation uses high energy X-ray or other particles to destroy the DNA of cancer cells. It may come from a machine outside of the body, also known as an external beam radiation, or a radioactive material placed inside of the body near the cancer cells, known as internal radiotherapy. This picture shows you the size of these radioactive seeds that are placed inside the body. Very common form of radiation in patients with prostate cancer. I hope you can see it clearly in this picture. You have the prostate gland, and then you see these radioactive seeds being inserted in it. Now, since this is internal and localized, where the cancer is, there are less side effects associated with it. Lastly, let's discuss the medications. There are 4 main types of drugs we use to manage cancer patients: chemotherapy, hormonal therapy, targeted therapy, and immunotherapy. Chemotherapy is the OG. This is the one that we've been using since early 1940s. It works on the DNA to interfere with cell division, which will lead to cell death. One of the downsides of traditional chemo is that it's non-specific, so it targets the normal cells in your body that also divides rapidly. This translates into side effects like nausea, vomiting, and hair loss. Some cancers depend on hormones to grow. Example, breast and prostate cancer. Hormonal therapy aims to block or reduce these hormones. So in breast cancer, we are blocking or reducing the amount of estrogen and progesterone. And in prostate cancer, it's testosterone. Targeted therapy is also known as precision medicine or personalized medicine. These agents target the proteins that results from the genetic mutations. These proteins are what's causing the cancer cells to divide abnormally. These agents work only if the patient has that molecular target, and not all tumors will have a target with an available drug. Now, unlike traditional chemo, it's targeted to specific proteins, so they have a more tolerable side effect profile. And finally, we have immunotherapy. This represents a new paradigm in cancer care, a type of cancer treatment that helps your immune system fight the cancer. A lot of research has shown that tumors have mechanisms to hide themselves from your immune system. So it reduces or completely erases the ability of the immune system to help with fighting the cancer. Immunotherapy unblinds the immune system so it recognizes the tumor and kills it. And that will be the end of this video. Make sure to hit the like button, subscribe, and leave your comments and feedback down below. Follow me on these social